The coordinators having a more regular presence at GP surgeries has really resulted in us having better relationships with all the staff, especially the reception staff and the carers champions. And they then, because they've met us personally, aren't afraid to pick up the phone, to ask us for information, which we're always encouraging them to do. And we regularly now get inquiries connecting their patients with the third sector via the community coordinators.
We have been working with the community coordinators who have been a great help and support in providing information and training to our staff as a whole. They're very useful in helping patients signpost to the services that are out there.
I was very impressed by the calibre of the coordinators, their background, their work experience, their personality, their dynamism, their wisdom, their enthusiasm. It was a very exciting meeting for me because I could see that we had a team of people who really knew what they were about, and we were not starting with a blank sheet of paper.
We've also been working with the community coordinators to bring in the third sectors to actually utilise our practice base to hold a mini roadshow, so to speak, to provide the ability for patients to speak to some of those third sector organisations and to understand how they can help them and their family.
One of the challenges for me as a GP, particularly in a large practice like mine where we have a number of doctors and nurses and then we've got a team of reception staff, is communication and knowing what's going on, knowing what services are available, knowing who is available to help our patients. And very often we simply haven't got a clue. The community coordinators have been magnificent because we have newsletters, we have meetings. So now we know what's available. We know what training courses are available, for example. We know what third sector groups are available. We know what support groups are available and where things are happening. So it's fantastic.
One of the areas that we're looking at as future development in working in partnership with our colleagues in the third sector is in the annual flu vaccination season, which is going to shortly be upon us, and we feel that it would be a good opportunity to actually use a larger venue to be able to invite a larger group of our patients to be able to come in and not just have their flu vaccination, but have the opportunity to then meet with our third sector colleagues who will then be able to use that opportunity to educate and provide more information for them.
There's a great deal of expertise out there. There's a great deal of wisdom. There's a great deal of practical experience, which can fill a lot of gaps in terms of the services people need to help with coping, to help with well-being, to help with getting better. And so these are the kind of things where, for me, the third sector has an incredibly important part to play in how we, as one bit, in terms of the NHS, we're one component of helping people to be as healthy as they possibly can be at every stage of their lives.